Hey, everybody, welcome to the Home Care Forum podcast with your hosts, Sasha, Guillaume, and Emina Poricanin. You know, your name always is spelled like so weirdly wrong. I'm like, I gotta fix it on at least on the first attempt at ChatGPT. But it gets my name wrong as well. Anyway, we'll keep this in, but I can't go through all the times I mentioned Amina's name. But welcome to the podcast. We have a lot to discuss this week. We were up at Advocacy Day together, and we met with the legislators and a lot of positive feedback. So we want to bring you up to speed on that. Emina, how's it going? What was your take on advocacy at a high level?
So, high level, I thought it was overall optimistic. It confirms what a lot of fiscal intermediaries and providers already think, which is that the governor is pushing for this. Perhaps the speaker, Heastie, as well, and then Stuart Cousins, because they are in the union's pocket. However, um, the rank and file members of the Assembly and the Senate have grave concerns about their constituents being ready for April 1. However, also, they are powerless to change this because the governor has dug in her heels. And so they are resigned to make the best of this. There's certainly, I think, some consideration of a delay past April 1. The unfortunate fact is, though, that the budget will probably not be finalized until after April 1. So providers need to make some immediate decisions about what they're going to do here going towards April 1, while hoping that it will all unravel or be postponed at some point once the budget is finalized after April 1. There's no way that this is coming out before April 1, any sort of delay, coming out before April 1. That's highly unlikely that the whole budget process, and there's a lot going on. It's not just CDPAP. This is definitely front and center of a conversation. It's a huge conversation, but they're not going to put out a law postponing this before the entire budget. It's highly unlikely. I guess it's possible, right? If we had to put a percentage on it, there's like maybe 1% in my humble opinion that it's going to come out before the budget. So what that means is that even if there is some sort of a delay, we're not going to know about it until after April 1, at which point you will have to turn over and stop providing services. So at the very least, even if you don't turn over or terminate all of these personal assistants and consumers, they will be without service through your FI on April 1, on April 2, on April 3, or whenever it is that we possibly get a law delaying the SFI. Make sense?
Definitely makes sense. And I would also caution anybody if you hear anything that comes out now, like, we're still in February. I don't think the one house has come out yet. And anything that comes out today, like there was something that came out on an HTD, people are losing their minds already. Listen, you have some time. This thing's going to change a few more times, though we know that the NHTD is in the target of the Department of Health for changes there. So let us start. Last week on Wednesday, I had the pleasure and honor of presenting to the New York City Council, where they issued a resolution to support the Rivera and Sturpey single FI law to replace the single FI with a licensing process. There were other senators that showed up and watched the committee hearing, which is a good sign that there is support in the Senate. But the Senate isn't really where we need to change minds. It's surprisingly, or maybe not surprisingly, that it was difficult getting appointments to see Hasty and Stuart Cousins during Advocacy Day yesterday because they are the holdouts. They are carrying water. They're actually in they cover the area that I live in, and I was hoping to get to speak with them as a owner and a resident in their district, but that didn't happen, and I need to find another way to get in front of them. But the issue or presentation that resonated most with me was delivered by one of the aides. PPL is telling those who call about the transition that the reimbursement rates will be between $15 and $17 per hour when compared to the 1910 that agencies are required to pay now plus benefits. This will be the wage that we will continue to pay if the single FI is repealed, but somehow they have the ability to reduce the wages and even the possibility of eliminating wage parity, right? So the aide basically stated that this new wage rate would not be suffice to pay for and support his family. And though he loves the consumer that he works for and has been with the consumer for the last 4 years, he made it through COVID. This will result in him having to make a difficult decision. And the message seemed to resound and resonate throughout the room because the thought of how many other people are going to have to make this tough decision as well. So that was a very scary thought to the consumers who were in the room. And again, I think it resonated with the board members, and that's why they signed a resolution to support the Rivera and Sturpey bill, and they even offered to send a letter to the governor to have her reconsider this law.
So, some interesting statistics that I learned yesterday are that 80,000 supposedly are touted consumers as having signed up. That is not the number of consumers that have actually completed the process. And so there are over 200,000 cases, at least, of consumers that are believed not to be ready and slated to be ready as of April 1. It is my understanding from insiders within the plans that the Medicaid director, in preparation for the health hearings, told the governor, we are not on track, anywhere near close on track to convert an adequate number of consumers for this. And the governor supposedly flipped out and said, you make it happen. I don't want to hear anything else. Make it happen. And so she's digging in. I'm not sure why. This is going to result in a lot of people losing services, a lot of workers not being paid for weeks, possibly. As we talked about on the last podcast, a lot of unemployment claims that are going to affect businesses for years to come, that will increase the cost of doing business in New York, which is something she's supposedly, concerned about. But as you and I know, Sasha, having listened to the presentation of an attorney who was recently in the governor's office, this unemployment piece is just something that they recently became aware of. It is not something that was on their radar at all. So the obvious answer seems to be put some sort of a hold on this, some sort of a pause at least. But for whatever reason, the governor has dug in. So I don't think it matters to the executive that PPL is giving out misinformation about the rate of pay. But ultimately, when this does take effect, legally speaking, PPL is not allowed to get rid of wage parity or to pay below minimum wage than what current providers are paying. That's just wrong. The other thing I want to point out is that the plans have sent a letter with Leading Age and a few other associations. I believe HCA is on there as a co-signator. They sent a letter to the Medicaid director saying, we are not the bank for PPL. They are underfunded to take this on. They are not ready to take this on. We urge you to reconsider this and at least postpone it. So that was sent out earlier this week. I'm not sure if there will be any progress on that. And then again, from the speaker who was recently in the governor's office, he was not at liberty to say much, but he indicated that there will be some change in the next 30 days as far as this CDPAP, I'll call it a fiasco here, as far as this fiasco is concerned. So I don't know what that change could be. It needs to be a positive one, right, for the providers. I don't know that it gets worse for providers at this point. Lastly, for those of you who may not be a SEIU 1199 agency, there is extreme internal fighting among the 1199 leadership. And so the leadership that has pushed for the elimination and consolidation of CDPAP may be out the door. At this moment, I don't know when their elections will be held, but the new leadership that's coming in is highly diverse as far as ethnically, culturally speaking. And I believe that they are actually putting the interests of the caregivers ahead of union interests. I believe that we know the current leadership, all they care about is preserving the health fund and using KEVAP, using wage parity, Medicaid, right, to get their caregivers insurance benefits. So we're paying for their benefits 3 times effectively. But the new leadership, if they are successful in overturning the current leadership, could be more open to keeping CDPAP around. As we've discussed before, this consolidation of CDPAP is a big 1199 agenda item because they see it as a way to penetrate and unionize all of the personal assistants into one union. There needs to be one employer, right? The current unions who are representing any PAs or any workers, those go away. There's going to be one union, and apparently it's going to be 1199. So 1199 wants this consolidation of CDPAP to succeed because they think they can unionize all of the personal assistants. That's 300,000 people. The health insurance contribution for their health fund, their insurance is $2.30 per hour for the first 40 hours a week. Okay. And it's still not doing well. The health fund is still not doing well. So that's why they need CDPAP to help boost their health insurance program. But perhaps the new leadership could be convinced that this is not the way to go. And for the life of me, I cannot understand why the current agencies who have fiscal intermediaries who are going to be adversely affected by this, why they haven't gone to their union representatives and said, you need to stop this. You need to stop this. If you are coming to me to negotiate the LIXA contract, the new CBA for the LIXA, and telling me that you want to work with us in good faith, then you need to tell your lobbyist to cease all of these efforts to unionize CDPAP because it's going to hurt our business. I don't know why that hasn't been done. I don't know that anyone's thinking that way. A lot of the agencies are out for themselves. You know, speaking of the union, I'm in the process of negotiating an amendment to their CBA for 2025. And as in the past, they go to a few agencies that I think have some weaknesses in leadership and convince them to sign an amendment to the agreement. And then they go to the rest of the 1199 agencies and say, here, sign this agreement amending the CBA because these 7 signed. So if it's good enough for them, it should be good enough for you. And give us all of your KEVAP money, by the way, while you're at it. So at no point, in my knowledge, any of these agencies said, hey, wait a minute. If the union is telling us what to do as a group, why don't we go back to the union as a group ourselves and tell them, knock it off with the CDPAP stuff? Hopefully one of these folks will listen to the podcast and call us, Sasha.
Well, that's pretty huge news. I think you were holding out for the podcast to
Which
let me
one?
know about the infighting in union and the possible change of leadership. I mean, if that would be a huge reversal of their stance if the new union heads would overturn this thing. So that's great to hear. And to your point about the unions or these agencies possibly, considering themselves only, I'm hearing that there's another list of agencies that are working with PPL and a huge union shop was added to. So the list wasn't shared with me, but somebody who had the list told me. So we'll be looking out for that if that comes out in the next few days. I know there are people who've been listening to the podcast and direct messaging me about the lawsuit that we have regarding the single FI Principal Home Care LLC versus Commissioner McDonald. And I am encouraged by the recent hearing that we had on February 24th. Judge Garnett was fair, I believe. She pushed back on both sides. Judge Garnett seemed to be open to the fact that business closures would cause irreparable harm to the businesses and to the owners. The lawsuit references the takings clause, and the judge seems to bring up the issue that the precedents in the takings clause were not directly applicable, but indicated that this case would be a new category as we do not have a direct state contract, nor is this a fully private contract. So the fact that we are paid with Medicaid funds in the CDPAP program and we have this quasi public private partnership with the intermediary being the MCOs. Um, so this is the reason why this new category might need to be considered, and so she'll likely pull a little bit from the cases that dealt with state contracts and a little bit from private contracts. So there was no ruling yet made from the, not, or at least not a ruling from the bench, and we're hoping to hear something in about a week. So the takes clause and the new category seem to be more relevant when considering the question posed by Judge Garnett to the defense at the beginning of the trial, which the defense, in my opinion, completely flubbed, and we'll see the reason now as I further explain. The question was if there were any other states or any other entities administering CDPAP directly. And the defense responded no at first, and then she clarified, saying no, not to her knowledge. And I so wanted to jump in, and I didn't want to be held in contempt, but I wanted to jump in and say, hey, listen, there is the ISIP program, which allows or has the services, the CDPAP services as well. So that program existing, I think, both hurts and helps our case as well as hurts the defense, because the defense made the statement that fiscal intermediaries would not be put out of business with the uh, with instituting the single FI, because we could go on and provide fiscal intermediary services to other industries or other companies, right? So she really didn't understand how this works, right? But the fact that the ISA program exists, okay, you can make an argument that yes, we could pivot and provide CDPAP to the ISIS program via an RFO, RFP. Okay. But the fact that the ISIP program exists and is being administered by the state would also potentially hurt the defense, because that could be the vehicle that the governor should have gone to have administer the program instead of awarding it to PPL. Right? If there's another vehicle administered by the state, why bring PPL in? Just shift it to ISIP. So those are the reasons I felt good about the case.
So separate from your lawsuit, Sasha, and by the way, do you have the name of that lawsuit, the caption? Is it your company that is the
Yes,
only?
it's no. There is prompt is another agency. There's a few agencies. But they're not named in the. They're just add-ons.
Okay, so your agency
It,
name is the
yeah,
principal one.
yeah, yes. It's Principal Home Care et al. V. McDonald SDNY docket number 24-CV-7071.
McDonald being the Commissioner
Commissioner.
of Health.
Correct, correct.
We also know that there is the Freedom Care lawsuit, and there were additional submissions earlier this week or late last week. So a decision is pending there. I haven't received any feedback about how that went. And then we do have the caring professionals lawsuit out there as well, where discovery was ordered. You may have had a chance to speak with some of the caring professional folks. Any update there?
Yes, the caring professionals team seemed very confident that this is
As they
that
always are on
yes,
everything.
this thing is dead in the water. It's not only uh, is it that the lawsuit is going so well, but supposedly some people have gotten to Washington, D.C., and they're expecting something from the administration,
Federal
w
administration.
federal administration within the next 2 weeks. And
Interesting.
whether that's direct or via CMS, they were very confident in that something is going to give.
Hmm. Okay, then. Well, the other point I wanted to just mention as we close out, because that is pretty much all the news that I have to share, is this federal managed care tax that is slated to come to New York. And New York is already planning how to distribute money from that tax. All healthcare providers in the New York healthcare continuum, hospitals, nursing homes, assisted living, have been named there except home care. So New York State Healthcare Providers Association, on their lobby day, the first ask that they had was to ensure that home care is added as a recipient of that federal money. There are ambiguities about how, when, and if the funding will actually come through. There's still potential litigation, I guess, as far as that tax is concerned. But I think we made a pretty good argument that there needs to be a mention. This is not a bill. This is just a mention in the overall healthcare budget, distributing some portion, specifically 150 million to home care.
One of the points that we made was the fact that this MCO tax, which is a lot of the funding comes from services related to home care, and these funds are going to be redirected or allocated to non-home care related, right? So we're subsidizing these institutions, the nursing homes, the assisted livings, the hospitals, uh, and they're using that money to, for example, hire nurses at a higher rate, and we can't compete at those levels. So we're subsidizing their operations to our detriment because we can't then compete, right? So I think it would only make sense that some of these funds find their way back to us, and so that therefore we can compete and attract and pay for nurses and our admin staff to support our operations. In addition to that, the 150 million, we're requesting language to direct the funds 100% as a pass through the agencies instead of allowing the MLTCs to skim some money for their admin fees or what have you. They've done it in the past. We're asking them to do that. And to that end, we also asked them to support A700 Gonzalez Rojas and S707 May, which calls for transparency at the MCOs. So not only for the 150 million, but for ongoing transparency for the regional minimum base rate for home care, which was requested in the bills A1112 Paulin and S3599 Rivera.
Can I just
So,
clarify that a little bit? So these are two specific different proposals. The first one would
correct.
propose to establish a regional reimbursement rate. So, and what the regions are is to be determined. But basically, in the spirit of transparency, it would require the MLTCs to fund at least the minimum amount required for that regional wage. Right now, there's nothing in the law that affirmatively says MLTCs have to pass down this much money to the providers. And I have this conversation all the time because there's this general understanding that, hey, the Department of Health is funding minimum wage, funding wage parity, so the plans need to pass it down at a minimum that much. And the plans are like, show me where it says I have to do that. Because what I'm giving you across the board, everything combined, is enough to cover that plus your overhead payroll taxes, right? Everybody on who's listening to this has heard that. And so this would kind of lock in the MLTCs to pay you at least that minimum, number one. The second proposal has to do with requiring the Department of Health and the MLTCs to produce information, metrics about patients, costs, expenses, stuff that the Department of Health has been stonewalling providers about, and that would really lend a lot more transparency about what is being required of these plans. You know, it's funny, because this is such a popular topic, in a few of the sessions that I attended, I mentioned the murder of that United Health CEO because there's this fascination with it. And I think until that happened and people started listening to it and paying attention to it on TikTok, and it doesn't hurt that the murderer, presumed alleged murderer, is, a young, attractive man. So I think that's what's created all of this. I see a Netflix series in the making, honestly. But that really opened up the question of, I think, mainstream America of what does managed care do? Right. And you see all of these TikToks about doctors who are now saying, you know what managed care does? They take me out of surgery so I could justify why the person who is under anesthesia already is going to be staying in the hospital for 3 nights instead of 1 night to recover, and things like that. So there was this huge outcry, and actually United did send a cease and desist letter to such a physician who's been talking back and against managed care to say, look, this is false. We're not really bad guys. But I mentioned this, and it was so interesting how the ears of those young legislative aides perked up, because that is the TikTok generation, right? There's all these videos out there on social media. They're not immune to that. And so they're listening and following this United CEO murder, and now they tie it to what's going on in home care. So when we're talking about these guys are the bad guys, they're the insurance companies, that on the national level resulted in the CEO getting murdered. I saw the wheels spinning and like things clicking that I haven't seen before. So I hated to use that example of a man getting murdered, but it was so effective.
I'm going to purposefully edit my words, not video edit, just edit what I'm about to say. And uh, you'll do your own research. And if I find a way to have this conversation in a future podcast, I will. Because the MAP program
Mm,
is it's a bit more controversial than it may seem,
mm,
because there are a lot of things that are not necessarily discussed. The good is always discussed, the bad not. And I think it's something that we need to further educate ourselves on, because at times we are offering and selling this product to our members, right? And whether it's a direct Medicaid plan versus managed plan versus this type of plan versus that type of plan. So it's we need to be fully educated and not just go along with what is being presented by marketers in the field. Somebody who might have done a 6-week training and then they're selling insurance. So I don't know that to be true. I'm speculating on the amount of training, but it's we want to do what's best for our clients, our patients. And that's it for us this week. Thank you for listening to the Home Care Forum podcast with your hosts, Sasha, Guillaume, and Emina Poricanin.
make sure you hit subscribe.
Please, yes, like, follow, share, subscribe. Thank you. Thanks for reminding Emina.
Bye.
Bye.